Dominic Nitewole is defense minister. To other stories, in Ghana, 1 out of every 5 children has a functional learning difficulty. This learning difficulty is more common in children aged 5 to 17. Many teachers also lack the ability and knowledge to identify such students in order to provide assistance to their pupils. This is according to findings by the Institute for Educational Planning and Administration at the University of Cape Coast. The research notes that the situation is a major contributor to failing educational standards and warrants an effective inclusive education policy. Samuel Mbura has more.
Which seek to identify challenges confronting inclusive education in Ghana indicate that pupils with disabilities have consistently poorer learning outcomes in reading, writing, and maths than pupils without disabilities. Director General of the Institute for Educational Planning and Administration, Dr. Michael Boachi-Yadom, tells JoyNews the challenge needs urgent attention.
Generally, we realize that there seem to be many more children with disabilities, otherwise referred to as differently able students or learners than we thought. That is the first point. The second one is that there also appears to be a lot of misunderstanding, inadequate knowledge about the characteristics of these differently abled learners. We might have assumed that many teachers have a very good idea, good knowledge of who they are, how they operate, and how to support them. But what we are realizing is that knowledge on the kids and who they are, their characteristics, is limited.
The highest proportions of children with functional difficulties were found in Volta, Eastern, and Upper West regions. Laura Lechi Atachi teaches at Kumbuni RC Basic School in Sogakope of the North Tong district in the Volta region. She tells JoyNews that identifying learning disabilities among her pupils has been a major challenge in the classroom.
Sometimes it's very difficult, but as teachers we are trying our very best to identify at least the minor ones that we can identify and manage them appropriately. Sometimes the sitting position in classes also, it's one of the methods we use to help such people, especially those who have problems with maybe their eyes or the ears.
Peterson Kwesi also teaches at Aduto EP Basic School in the South Tong district. He wants the government to provide resources for inclusive education.
We are hoping that gradually these trainings will be done to equip us with necessary skills, knowledge, and some level of values that we can use in handling learners with disability.
But the least learning functional difficulties were reported from the Northern and Greater Accra regions. Edward Olenu of the Central Mosque School in the Greater Accra metropolis says the inability to identify learning disabilities is contributing to the falling standards in education.
No, the problem is that you cannot assess them. You see, when you assess them and you have the results will inform you as to what to do next. But at their level, they cannot be assessed. And so sometimes we allow them to grow through the system just like that.
Meanwhile, principal researcher with IEPA at the University of Cape Coast, Professor Rosemary Sawa Bosu, believes adopting and implementing innovative adaptive teaching methods is one way of bridging the gap.
The world is changing, and globalization requires the world population to quickly adapt and learn to work with new technologies. So adapting and successfully implementing innovative, engaging, and adaptive pedagogies is one way that to achieve what the Action Area 2 of the Save Our Future paper talked about.
To achieve this for all marginalized populations, education systems must be examined and reviewed to ensure learning methods meet the needs of learners. Samuel Mbura reporting for JoyNews.
We can now go on to the phone line and speak with Dr. Mabel Otibwedu of the Psychology Department of the University of Ghana for more on this. Doc, are you surprised that there's inability by teachers to identify children with special needs in learning?
Good morning. The name is Otibwedu.
Thanks for the correction.
Okay. Thanks for the question. I'm not too surprised that we have difficulty identifying children with disabilities in Ghana. I think policymakers and the government itself knows about this limitation because we do not have the necessary assessment tools to be able to detect this. And then we do not have the knowledge. So that is what is causing the problem. We have some assessment centers that have been established in the country to, deal with these, but they are not in good shape in terms of they don't have the necessary resources, the cultural norm tools to be able to screen and identify these children and then be able to include them in the various classrooms.
Now, do you think that our inclusive education in the country is effective?
Okay, thank you. I can say that Ghana is making some strides in terms of our inclusive education. Generally in education, we're making some strides. And then in 2012, when we ratified the UN Convention on the Rights of Persons with Disabilities, since then we have made significant growth. And then in 2015, we introduced the inclusive education policy. However, and this policy basically seeks to ensure that there's equitable access to education, there's participation by all, and creates a friendly environment for even persons with disabilities, as part of a mainstream classroom. However, it is beset with certain challenges that have made this success story to be a bit, difficult to tell. And some of the challenges, listening to our other speakers, some of the challenges basically are the resources needed to make this inclusive education work. That is, if you decide that there are going to be there are no more going to be special schools and that all children with disabilities are going to be parts of mainstream school, then you are ready to provide them with all the needed tools and resources to be able to feel part of the class in terms of, aids in studying when it comes to those who are having hearing difficulties, visual, those who cannot have communication difficulties and all. So all those should be provided with, and then that is what we are lacking. We lack the teaching and learning materials. They are insufficient. And then also we don't have teachers who are competent enough. I know there are training teachers in Cape Coast University, at Winneba. They are also University of Education are also training teachers, but it seems not to be enough. More needs to be done to be able to get teachers who can even identify these children and support them. So, and then those are the two challenges I've mentioned. And then we have accessibility to these schools. We have our schools. We want to include children with disabilities, but access is difficult when it comes to going into the school, going into the classroom. I remember in a school there's a staircase, and there are no other places that people could use their wheelchairs and all that. And so we have to lift the child across the staircase to the classroom. How many or since when are we going to be able to do that? So accessibility to the school and to the classroom is also a problem. And then one other major problem that I'm so much concerned about is the attitude of parents. The attitude of parents, the attitude of community. Many people in our communities have a negative view of children with disabilities, stigmatize them, they see them as not part of us, and the fact that they cannot learn in the usual classroom. So thinking about taking them to mainstream school is something that is unheard of And many parents actually hide their children. They don't want anybody to see their children, so they will not even allow them to be assessed, to be placed in the schools. And these are some of the things I think are creating challenges for the inclusive education policy.
Dr. Otibwedi, let me ask you, what are your recommendations to address these challenges?
Okay. So basically, if we are able to provide or resource our assessment centers, you see there's an assessment center at Achimota, and it's been under construction for some time. It's not completed. So if we're able to resource our assessment centers, and I know there are others that do not have the resources, the competent people to do the assessment. So we need more resources in these areas. And then we also need to improve on our training for our teachers. Our teachers need more training and then work on their attitudes. A teacher could be trained, but still would be holding on to these negative attitudes and would mistreat these children in the classroom. So we should work on that. And then we should continuously gather data on these children. They are all over the country. We should look for them, get the data, and then we can work on them. And then lastly, and then provide appropriate sources. Some children can only communicate through pictures and all that. We should be able to provide these and also support our parents. Many parents who have children with disabilities are left on their own. And when they are left on their own, they are not able to make decisions that would be in the interest of the child. They do what they think they can afford. And especially those who have children with severe disabilities will think that they will take their children to special schools, but they are also very expensive, and it's creating a lot of problems for our parents. So I think these are some of the things government can do to help with that. If we no longer want to continue with special schools in existence and we want every child to be part of the mainstream school, then we should put things in place well to be able to accommodate all of them.
Dr. Mabel Otibwedi, I'm grateful for your time. She's a psychologist.